I'm Dr. Anjupriya, consultant at UVA Health. Today, we have Dr. Keshavan Nandishan, Medical Director and co-founder of UVA Health with me. Hi, Doctor.
Namaste.
Namaste. We have noticed a growing trend of working women experiencing IBS, particularly in Bangalore. Studies suggest that about 15% of the population in India is affected by IBS, with a majority being women. Many working women are seeking treatment after unsuccessful attempt with other methods. Why do you think this trend is increasing, especially among working women?
See, Anju, what we see usually among all diseases, especially which are predominant due to anxiety, stress, and lifestyle disorders, you see a greater proportion of women getting affected. So, IBS is also one of those diseases where women are more affected than men. And IBS per se is a functional disease. It doesn't have any pathological or any abnormal disturbance in the body as such, or you don't not be able to appreciate anything in the blood work or something like that. It's a functional disease. And in IBS, one of the most important symptoms are imbalanced bowel motility, leading to diarrhea, sometimes constipation, sometimes gastric symptoms like bloating, abnormal cramps, abdominal cramps basically. So all these factors and a collection of symptoms constitute irritable bowel syndrome.
Okay.
And as it is common to every disease, the hormonal component in women plays an important role in the fluctuating symptoms of any disease, including IBS. So you can take any autoimmune diseases like arthritis, you can take degenerative diseases like spondylosis, migraine kind of headaches. So in most of these diseases, the hormonal component in women play an important role in fluctuating the symptoms. Even we can see that in many autoimmune diseases, during pregnancy, you can see the disappearance of the symptoms. And after pregnancy, the disease again comes back. The best example would be multiple sclerosis, where you see the patient suffering from multiple sclerosis. When the lady gets pregnant, all the symptoms virtually disappear. And after delivery, slowly the disease makes a comeback. So the hormones play a very crucial role in the disease manifestation and the disease progression in most of the women. So in IBS also, as you very well understand and most of the people know that irritable bowel syndrome as a disease, the psychosomatic component in the disease manifestation is very important. Most of the problems are related, apart from the lifestyle and food habits which play a crucial role, there is the stress and anxiety part, the psychological component, which plays a triggering role in initiating the disease process. In women especially, along with the aforesaid reasons, the hormonal component plays a very important role. As you know, even in IBS, we see in relation to the menstrual cycle, after the ovulatory phase, when a lady is nearing her menses date, most of the symptoms aggravate and fluctuate. So that hormonal component plays a very important role in IBS.
Many women are curious about how hormonal changes during menstruation, pregnancy, and menopause affect IBS symptoms. Can you explain the correlation between hormonal fluctuation and the severity of IBS symptoms, and how Ayurveda can help manage these issues?
So, Dr. Anju, as I had mentioned earlier, like any disease, even in IBS, where the psychological component is so important and relevant, definitely the hormonal imbalance or the hormonal fluctuation in women directly affect the IBS symptoms. For example, when the person is highly stressed and having a lot of anxiety, the women definitely will show some kind of hormonal imbalance, IBS symptoms. You can see more patient going, having a lot of bowel movements per day, maybe 5, 6, 7, 8, 10 times a day. You may see aggravated symptoms of bloating. You may see aggravated symptoms of abdominal cramps. overall, all the classical IBS symptoms are visible when there is lot of hormonal imbalance. So even in a normal cycle, for example, a lady is suffering from irritable bowel syndrome, even during the menstrual cycle, you can see that her symptoms will be peaking just after the ovulatory phase and going up to the onset of menstruation, the 10 days where the IBS symptoms will be at its peak. And after her menstrual cycle is over, up to the ovulatory period, the next 10 12 days, you can see that most of her symptoms will be bare minimum or will be considerably less. So even in Ayurveda, IBS is considered as a disease of Pitta, and some amount of Vata and Kapha is also involved in the disease manifestation. And when we try to correlate the hormones in Ayurveda, hormones are nothing but the expressions of Pitta in the body. According to Ayurveda, hormones are nothing but the expressions of Pitta in the body. So any kind of Pitta fluctuation or any kind of Pitta disease, there might be an hormonal component to it. So you can see diabetes, you can see thyroid, all these are Pitta dominant diseases according to Ayurveda, where hormonal component is always involved. So when you try to manage IBS in Ayurveda also, along with managing the Pitta and Vata in the physical part of the body, the psychological component of Vata and Pitta is also to be considered. So when we treat such diseases, we also try to give them counseling. We can tell them to do some yoga and meditation. And in terms of medicine also, we give some treatment which also helps them to calm down their anxiety and stress, along with the regular IBS treatment which is needed for the patient.
Okay, sir. A lot of patients ask for a simple, effective medicine to manage IBS because there are so many over-the-counter products claiming to help. What do you think about these products, and can you recommend a specific Ayurvedic treatment plan for IBS?
As always, according to the philosophy of Ayurveda, there is no one treatment for IBS. It is very subjective and it is very patient specific oriented. So mild cases of IBS can be treated with the simple yoga, meditation, and some changes in lifestyle and food habits. But moderate to severe cases of IBS needs proper Ayurvedic treatment, and it has to have a time frame anywhere between 3 to 6 months, and a lifelong maintenance level of lifestyle modification and stress management. So when you ask me over-the-counter products, it is very difficult for me to name any product. There are a lot of classical Ayurvedic products available. You have to, in UA especially, we have a team of great doctors who have a lot of experience in treating IBS kind of diseases. So I would always say you have to look out for good Ayurvedic doctors who are able to specifically diagnose you according to Ayurveda and give you the best treatment available in Ayurveda.
Okay, sir. That be so well, sir. Thank you so much for the detailed explanation.
Thank you. Thank you very much. Bye.